Good morning, everybody. Welcome to Thursday, and today we're going to be talking about what you can expect in an initial consultation with your psychologist. Thanks for joining me. My name is Dr. Brooklyn Storm, and I'm the director and the head psychologist here at All Psyched Up. I'm all psyched up today because we're going to be talking about a topic that I absolutely love, and that's being able to welcome new patients and clients into the clinic. So what can you expect from a first session? Hey Jen, how you going? When a new client comes to us, what's going to happen is we will give that person a call, and we will let them know that we've received their referral. We'll have a brief discussion with them on the phone, introduce ourselves. We'll organise an appointment time, and we'll give them directions. And then when people come down to our place, they sort of check in at reception and they'll fill out some paperwork. So usually we'll email you paperwork ahead of time, and that includes things like our office policy, our privacy and consent form, and a brief assessment screener. So something like the DAS 21, which we discussed in a previous video. So if you got an email, you fill those things out and you bring them along with you. If not, you can just fill them out in reception before your appointment. So we'll encourage you to pop along a few minutes earlier. Then what will happen is one of our clinicians will come and receive you from reception, take you into the consultation room. The first session is really about setting up the expectations between the clinician and the client. So what we want to do is understand, I guess, the roles and the responsibilities of both parties. So the first thing that the clinician might do is talk you through the paperwork and go through something like the privacy and consent form line by line to make sure that you understand fully what's involved in that. And so the privacy and consent form is going to explain things to you about who can have access to your information, how long we store information for. It talks about your confidentiality, who we can, I'm not sure if I just said this or not, share information with and under what circumstances. And it also talks about the importance of booking your appointments, attending consistently, and it also talks about the fees and rebates and all that sort of stuff. So a psychologist will sit down with you, make sure that you understand everything in there, and that you understand some of the office policies that we have in place as well. Then we're going to talk about the referral that we've received, and we're going to, I guess, do a little bit of positioning around, what your expectations are of counselling. Have you had counselling before? How long ago was it? How helpful did you find it? What sort of worked for you in the past? What's brought you along today? What might your therapeutic goals be for counselling? So we'll talk about all of that, and we'll try and get some clarity around what's going to be achievable and what's not. And how we might be able to navigate some of those other things. I mean, sometimes people really only want to come for, the number of sessions that Medicare, for example, might rebate. So we have to be quite careful around what we choose to work on so that we can make maximum use of that time. Other clients come to us on employee assistance programs. And so when they come for their initial session, we have to do what's required by their employer, and that might be explaining the terms and the conditions associated with the employee assistance program. So for those of you who don't know what it is, if you're employed by an organisation, it could be that they utilise a psychology service to provide support to staff and sometimes to immediate families of staff members, to help them deal with any problems that might be impacting on their well-being. So these can fall into two categories, either workplace issues or personal issues. But regardless of that, the general thing around employee assistance programs is that it's for a very short, sharp intervention. We've got some providers that give us 2 sessions with employees, we've got other providers that give us 3, and then others that give us 4. So again, we have to be very careful around setting up the expectations in that first meeting about what can be achieved realistically and reasonably in those 4 meetings, and what the onward referral process might be, and how we continue to support people there. So a lot of the time, that first appointment with your clinician is really around setting the expectations, setting up the roles, looking at the therapeutic goals, and trying to develop some therapeutic rapport so that we can build on that and get you the outcomes, hopefully, that you're wanting to achieve within the time that we've got together. So it's really, every psychologist works a little bit differently. I can really only speak for how it works in my practice, but I understand that this is quite general. Most psychologists would do this and talk with you about how this would all work. The other thing too is that it's really important to talk with a psychologist about any concerns that you have in that initial meeting. And the psychologist is probably, hey Mel, how you going? The psychologist is also going to start taking a little bit of a history from you. So that history taking can take, part of the first session into the second and sometimes even into the third. It's really important that we understand where you've been, where you're at now, and where you want to be going in the future. If at any time you've got questions for your psychologist, it's really important that you raise them, because this process doesn't work, the counselling process doesn't work if there's a lack of transparency. And your psychologist would really love to hear from you if you feel like something's going well or you think that something will work for you. I got a coach of my own just yesterday, and she was asking me, how do I learn best? So I had to talk with her about, well, I'm somebody who does really well with checklists. If you just tell me to do something, I'll probably just fluff around and get distracted by life and, do it in a rush at the last minute. But if I've got checklists, I tend to be able to get a lot of satisfaction and pride from ticking each thing off. So do let your clinician know how you prefer to be worked with. Sometimes I will say to my clients, how do you like me to interact with you? Are you somebody who likes, short and sharp? Can I lay all my cards on the table with you? Or are you somebody who needs a little bit more of a empathetic, a bit more sensitive, caring approach? And so it's really important that we have that understanding. So that's roughly what you can expect in a first session. Really, the second session and the third would be continue on of the history and then commencing the treatment. But if you have any questions or queries, just talk to your psychologist about them. They can go from there. Anyway, I hope you all have a really lovely day today. It's gorgeous weather outside in Frankston. The beach is just across the road, so I'm going to head over there shortly. What else did I have to tell you? Oh, it's very exciting news. Yesterday we were offered an opportunity to provide outpatient clinic support for the rehab place wellness clinic that we're working with in Thailand. So that's all very exciting, and we get a contract for that on Monday apparently. So that's all good. In other news, where our lease is up on the practice here in Frankston, so we're just having discussions this morning with the team about what we want to do. You might remember we were talking toward the end of the year last year. Hey Lisa, how you going? I miss your face. We're talking about moving to one of two premises, so we're still in negotiations with that, and we'll see what happens from there. It gives us extra rooms, which means extra clinicians. So if you have a type of allied health profession that you think would be really, really helpful to have in the clinic, of course, please let us know. We're really open to that, and your involvement and your input is really meaningful and special to us. Good morning, Chrissy. Good morning, Kim. So there's that as well. So if you think it might be useful for you to have a physio, a chiro, a naturopath, a GP, a ped, that's fine. We can organise all of that. Just let me know. What else did I want to tell you? I think that's about it. It's just been such an exciting week here. But I'm off to Sydney for a little bit of work and a little bit of fun. Hoping to head out to Bondi Ink at some point, which would be lots of fun too. Maybe have a bit of a swim, I don't know, and we'll see what happens. I hope you all have a really awesome weekend as well, and I will see you on Tuesday. Thank you very much for spending some time with me. I really appreciate it. Bye guys.